Hello everyone. Today let's learn about active management of third stage of labor. Okay, so let's start. Definition. So third stage of labor begins from the birth of the baby till the delivery of the placenta. So in third stage of labor, what happens is it is the delivery of the placenta. So now why do we call it as active management of third stage of labor? Earlier what happens is like after the delivery of the baby we wait for the placenta to separate. We check for the sign of a placenta that has been separated or not, which is like lengthening of the cord or gush of blood that we see, and after that only we separate. But here in active management of third stage of labor, what we do is after we give the uterotonic drugs, that is oxytocin, and when the mother experiences a contraction, we what we do is like we at that time only we start separating the placenta. We start giving traction and start separating the placenta. So that is why we actively are trying to separate the placenta from the uterus. Okay, so and why is it important? Because it has been shown that if we do this method properly, chances of postpartum hemorrhage is extremely low. Okay, so there are four steps of AMTSL. So first is rule out second baby. Second is administer uterotonic drugs. Three is control contraction, and four is uterine massage. We will learn this one by one in the further slides. Okay, so first is to rule out the second baby. Once the baby is born, the first baby is born, we really need to check the second baby as well, because in our country there are many mothers who does not book herself for a ANC. That means she have never visited a facility or a hospital for her ANC throughout her pregnancy. So chances that she might be carrying out multiple, she might be having a multiple pregnancy is higher. So for to be in a safer side, we need to check for a second pregnancy, okay, before administering uterotonic drugs. So second step is you need to administer uterotonic drugs, that is oxytocin, and it should be administered within 1 minute of the birth. And where it is IM, and it should be uh, uh, administered at the anterior lateral side of the thigh. Okay, and oxytocin is a preferred uterotonic drugs because it acts quickly and it is also safer. So step 3, it is control cord traction. Okay, for control cord traction, what you need to do, your non-dominating hand should be placed on the symphysis pubis and should hold or support the uterus, and then your dominating hand should hold the cord and the forceps. So how and both your hands should be moving to on the opposite side of each other. Okay, so what you need to do is you need to pull only. You need to do the control cord traction only when the uterus is contracted. Okay, so during that time what you need to do, you need to then you need to gently pull the cord downward and forward. The traction should be downward and forward traction. Okay, so and after that, once you see the placenta in the vagina, then what you need to do, you need to leave both the hands and then hold the placenta and rotate it slowly and gently, and then deliver the placenta. Okay, it should be very gentle, because so that you avoid any placenta fragments retain placenta fragment should not be retained in the uterus. That is why you need to slowly and gently remove the placenta. Okay, so step number 4, it is uterine massage. Very, very important. Soon after the placenta is delivered, what you need to do is you need to make a cup shape, and on the fundus of the uterus, what you need to do, you need to massage it. Okay, you need to massage it till it is firm and contracted. Okay, so there are few things that you need to remember. So one is always perform the control contraction only during contraction. Okay, after that, you also should encourage regular self massage of the uterus. You need to encourage the mother to self massage the uterus after the baby is born and the placenta is delivered. Okay, and then what you need to do, you need to check the completeness of the placenta. This is also very important. And oxytocin should be kept at a room temperature before the delivery. Very important, because oxytocin is kept in the fridge, so it should be taken out priorly before the delivery, at least half an hour prior, and then kept and then administer. Okay, thank you. If you find it helpful, then please do share with your friends and do not forget to like and subscribe. Until then, see you in my next video.